Good afternoon, everyone. I'm Chuck Friedman. I'm the chair of the Department of Learning Health Sciences and one of the co-chairs, along with Doug Van Houweling, of the Learning Health System Collaboratory of the University of Michigan. Today, we are extremely delighted to have a program for you that is co-hosted by the Collaboratory and our University of Michigan School of Dentistry, which, as you will hear, is an active participant in the Collaboratory by virtue of the School of Dentistry's program to become a learning health system. So today's program will focus on digital transformation in healthcare for a diverse world. Next slide, please. And our plan for today will begin with opening remarks by Professor Alex De Silva, whom I will introduce in just a moment. And following his opening remarks, we are extremely fortunate to have with us Bernardo Mariano, who's the Director of Digital Health and Innovation and the Chief Information Officer for the World Health Organization. We believe Dr. Mariano will be speaking to us from Geneva, so we thank him for devoting some of his evening to be with us today. Dr. De Silva will be introducing Bernardo Mariano. That talk will be followed by remarks from Dean Laurie McCauley of the University of Michigan School of Dentistry, reflecting on the presentation that preceded. This will be followed by audience Q&A. And then at around 1:15, the plenary portion of the session will end. And we have arranged for you three excellent breakout sessions focused on learning health systems and pain, learning health systems and caries risks, and learning health systems and opioids. Each breakout will have two hosts. And at the end of the plenary part of the session, we will provide instructions for how to enter your breakout room of choice. We're very much hoping that most of you will stay around and participate in the breakout sessions that will follow the plenary. As will be explained, you should have received in response to your registration for the session, an email with the links into the breakout rooms. Don't go there yet. That's yet to come. This will all be explained after the plenary part of our meeting today ends. Next slide, please. So now it's truly a privilege to introduce Alex De Silva, who will be speaking briefly and introducing Bernardo Mariano, our featured speaker today. Alex is the director of the Learning Health Systems Initiative from the School of Dentistry, in addition to being an associate professor in the School of Dentistry's Department of Biologic and Material Sciences. So Alex, thank you for your excellent work in assembling this session for us today, and let me turn the podium over to you.
I'd like to immensely thank Dr. Friedman and the Learning Health System Sciences Department members, including Kathy Karagiannis and Lisa Ferguson. The Collaboratory is a cross-campus initiative that is incredibly expanding our knowledge regarding learning health systems. I'm also grateful to Dean Laurie McCauley for her vision and support to our Learning Health System Task Force at the School of Dentistry, integrate innovative digital health to optimize dental treatment, education, and research. As a disclosure, I'm the co-creator of GeoPain. I'm also the co-founder and co-owner of Moxitech, which is a startup spin-off which licensed the technology from the University of Michigan. So I'm a, clinician researcher. I look at the brains of patients with chronic pain. We look at dysfunction, and one good example is one of our studies with the Department of Anesthesiology, looking at network hubs in the brains of patients with fibromyalgia. And we see that if there is an imbalance, we can then target with neuromodulation and provide efficiency in the system and provide relief to patients. So in our brains, we are all connected. The other thing too is in our learning health system task force, the work from Kate Weber, she looked for in several years for students, dental students, and how they request their clinical rotation changes. So with that, we can see the motive and the higher users or higher changers in their rotations. So then we can target those network hubs and provide efficiency to the system with learning health approaches. So we are all connected. Also, when we make available from our research labs technology to track the pain of patients at individual level, being the intraoral side or full body or dermatomes, we also look at aggregate data from a diverse group of our population, including age, different age models or gender. So if it is diversity, we can do machine learning or artificial intelligence to bring back information to the patient, either to diagnose or to provide the best treatment option to all patients. As we expand our international collaborations, we do have challenges. One of the collaborations that we are setting up is with Italy, with the Italian pain group, study led by Massimo Allegri, Dr. Massimo Allegri, where they're following up patients that were COVID positive, and after the disorder, they still have pain and other symptoms. So as we try to track those patients and setting up this in collaboration with them and also with Midas, the Rotary Club in Bergamo, one of the most affected regions in Italy, we do have those challenges as we offer digital health. It's like how to put it together, academia, private, and public sectors together. What is the challenge to make it sustainable for all people involved? The international private rules, for example, HIPAA or CDPR in Europe, data sharing and storage, where the data are going to be, government policies, how in Europe or United States, how things are going to be protected, the data from our patients, and even the local, state, or international cultural languages, how that we're going to influence these technologies. Because of that, with great honor, we have Bernardo Mariano Jr., our keynote speaker. He is in the forefront of global digital health. He's the director of digital health innovation and chief information officer for the World Health Organization. He started a global strategy on digital health as an enabler to achieve sustainable development goals. And one of the main things and objectives in his for his lecture is using digital health to improve health for everyone, everywhere. Again, using digital health because we are all connected. So with that, I will pass the lecture with great honor to Mr. Bernardo Mariano Jr.
I'll be talking about digital health, global digital strategy, which is a strategy that was approved by the WHO 194 World Health Organization member states last year. We went through that process of a global strategy as an evolution from the e-health strategy, which was approved in some 10 years ago. So that's this is just to show the evolution of the whole sector. Talking about evolution, let's start by comparing the health sector with other in terms of maturity or digital transformation. You can see that, and this is a research that we got from McKinsey, that shows that the latest one from McKinsey. We have something else from Gartner that shows that healthcare is still, or health sector is still lagging behind many other sectors on the digital transformation. The brick and mortar is in the center of health, meaning that today one has to go to the health facility in most countries to even to interact for 15 minutes with a practitioner or healthcare practitioner. But then we are not leveraging on the digital solutions to actually minimize that time, accelerate the assistance, and accelerate the diagnostic as well. So you can see that we still have a long way to go, but the pandemic, the COVID-19 pandemic, has shown that we have to accelerate to ensure that both from the use of technology, be it AI, blockchain, and others, for preparedness and response, we can actually bring and add the value that we all seek in the health sector in general. When you look at the adoption of artificial intelligence, the healthcare sector is still a slow adopter compared to other sectors such as finance and automotive or energy. And yet, health is at the center of all of us. I think the pandemic is demonstrating that health is not just about health and well-being or universal health coverage. It impacts the economy, impacts all sectors of life, impacts politics. So therefore, with this pandemic, I believe that there's a realization that health is not just something that governments can put on the side and invest on based on the lower priority, but really put it at the top priority, because the impact can be quite significant, as we are seeing during this pandemic. At WHO, the center of our strategy, which we call General Program of Work, is really about promoting health, keep the world safe, and save the vulnerable. And the targets are what we call the 3 billion. So we want to, by 2023, we want to see 1 billion more people enjoying better health, and 1 million more people better protected by health emergency, and 1 billion more people benefiting of universal health coverage. So within that strategy, the digital health is an enabling factor that cuts across both the UHC, the health emergencies, and the healthier population, to ensure that we achieve the targets of the Sustainable Development Goals. As we set by 2030, we have some targets that the whole humanity through the UN system set to ensure that we have better health and well-being by that time. So to accelerate that, or to make sure that we achieve that, digital technologies or digital health is a key enabler. Working at the primary health care, working at the local level, at the country level, national level, at the regional level, to really benefit those good, positive health outcomes, of course, mitigating all the associated risks, both on ethical and on privacy, that those technologies can bring as well. Now, it's one thing to talk about those global targets. It's the other to talk about at the local level, at national level, what we need to do. I just described a scenario of a traditional way of delivering health, which is When you need a prescription, you have to go to a doctor. You have to book an appointment to get your prescription, and you have to go to a pharmacy to order your medicine. And in most countries, all that is done with a physical interaction. While telemedicine and telehealth and telemedicine is an area that has evolved from the technology side, but we need regulations to address and to really allow the whole sector, the whole world, to really maximize what such technology provide. Of course, at the national level and local level, we need to find that equilibrium between the way we deliver healthcare traditionally and the way the digital technologies and digital solutions can support that delivery. So what is the right equilibrium, I call it, to ensure that we leverage on both extremes to deliver the positive health outcome? And that includes the literacy of healthcare workers. It includes adoption by patients and people. So all that needs to be factored to really intervene at the right point, to create at the right equilibrium, to ensure that the investments on digital health and digital transformation that do yield those results and positive results that we can all see the progress and the maturity of that country or that community or that county or that state, that moves the needle from where they are today on the digital health maturity to the next level of maturity, to ensure that the progress that this sector requires goes into the right direction. So having that equilibrium is very key. Within the global strategy on digital health, which was approved by WHO member states last year, it's a 5-year strategy. We want to improve health everywhere. So accelerate those appropriate digital health solutions to achieve those sustainable development goal targets, to ensure that the health for all target is achieved with the enablement and acceleration provided by digital solutions. And that it involves a couple of key elements. One, we have the guiding principles for that. So decision and commitments by country is key. So there is a key role for countries to commit to work on policies, national policies, strategies, but also investments, as well as governance at national level, to ensure that the digital health adds that particular positive health outcome we want to see added. Integrated strategies, the other key principle. Health sector, it's highly siloed. It's very easy to develop one key vertical disease area, be it TB, HIV, or hepatitis C. So it's easy to develop that vertically, but to really leverage on the power and enablement of digital technologies, we need the cross-cutting, key cross-cutting areas to be developed, including patient data, including governance, including which framework we use for AI for health devices, and let alone others, such as, for instance, what we just now working on, which is a digital vaccination certificate, and I'll come a bit more. I'll say a few words more about that later. Of course, the ethical use of digital technology is key. Understanding that from far east to far west, from far north and to far south, we have different key principles on data protection principles or data protection and privacy rules. So how can we ensure that there is ethical use of technology? Also, we have to be cognizant of the clash of cultures, I have to say, if I can use that word, between the health and life science and tech industry. So the health life science, the culture and the key, some of the guiding principles are around donate or help others through either donating blood or donating organs or donate. There's this will to do something to help somebody that needs something that I can provide. While in the tech industry, the culture, especially on the digital giants, it's about monetizing on data. So how can we find a way of those two very distinct principles and cultures to coexist in such a way that we bring those benefits that we need to see with the technology, especially those benefits on health and the positive health outcomes, so that therefore the ethical use of those technologies is key. But let's not forget the impediments and challenges that the least developed countries have. The decisions that they have to make between invest in food security or invest on digitalization of the health system. So those are some of the challenges that we cannot underestimate, and we have to ensure that somehow, as we take the whole world into that process of transformation or digital transformation, we do it in such a way that we see countries, be it the fully highly developed middle-income countries or low-income countries, we see the progress that they having as investment prioritization strategies are implemented to leverage on digital technologies to achieve those targets, national targets, regional targets, or global targets. The global strategy has 4 strategic goals. So one of them is promote collaboration and knowledge transfer. There are areas such as telehealth and telemedicine. It's key. How can we leverage on the governance that change some current governance to allow, for instance, a medical practitioner in one state to be able to actually see a patient from a different state, if I talk about US, or from a patient in one country in Europe, like in Switzerland, where I'm sitting now, to be able to see or be seen by a doctor over using a telemedicine and telehealth, to be seen by a doctor that's sitting in Spain. So imagine that within the pandemic situation, where health systems were in the brink of collapse, or some of them actually collapsed. So imagine the power of telemedicine in such a scenario. Yet the regulations are not conducive enough to allow the scalability of health system provisioning from national border to a regional context, where then non-communicable diseases, patients with non-communicable diseases would not suffer, for instance, because the health system of that particular country is overwhelmed with the response to COVID-19 pandemic. So how can we leverage those kind of situations? Collaboration is key. Of course, the national strategies, implementation of national strategy or national roadmap or principles or plans, it's key to how do we bring this element of plan, invest, and see the value added, learn from it, and then see the progress, the maturity level of that country, especially in primary healthcare and universal health coverage. The other objective is the governance. One of the key elements on the global strategy on digital health is a framework for international health data regulation, which does not exist today. If we talk about portability of personal health record, for instance, today, if I take the analogy in the financial sector, the fact that you do e-banking, or you have a card, a Visa card that is issued by country A, it doesn't stop anyone to go to country B and then be able to digitally interact either through e-commerce or other ways within that particular country. So how can we strengthen that interoperability in such a way that the portability of health data through a level of governance of health data that allows these patients or people to move across? And that's where, for instance, the work we're doing with the international digital vaccination certificate is key. Today, we do not have even a physical vaccination certificate for adults. I think there was a lot of investment for children vaccination records. In some countries have a digital record, but people like myself and others that travel a lot, the only card that we use to store the immunization record is the yellow vaccination card, which is actually, as part of the International Health Data Regulation, that is a requirement for travel into certain countries. Personally, I use that to record my tetanus vaccine, hepatitis B, A and B vaccine. So the same card, which is meant for yellow vaccination certificate, yellow fever vaccination certificate, is used for the purpose of recording my immunization record. If I was a person that never needed to travel to a country that requires such a yellow vaccination card, most likely my immunization records would be spread in between the countries I travel where I required some sort of a vaccine, which was not the yellow vaccine as requirement. So this is where, as part of WHO, we see that our work in terms of creating norms, standards, and guidelines around issues that are key to create this interoperable world. It's important, and now we are working with a number of countries, a number of experts and stakeholders to accelerate at least the key standards that we want to see on that international vaccination certificate, or digital vaccination certificate, to ensure that interoperability, to ensure that as the vaccination keeps taking place around the world, and if the requirement of that vaccine for COVID for travel comes into the fore, we are ready with the standard that allow us to perhaps implement that, and the countries can implement that, and vendors can use those standards to create that interoperable world. Understanding that today, of course, in the international health regulation does not have any rule that requires a country to demand a COVID vaccine for a traveler. At this stage, it's not there, but we just want to make sure that we are prepared in case that we go that route. But in any case, we need these digital immunization records because we don't have currently one that can be interoperable in such a way that the travelers can actually show the medical physician for another country when they want to share what type of immunization they have. Of course, this people-centered health system, it's key. So the centrality of people in the digital health is key, and that touches not just the patients or the public, but also touches even literacy of healthcare providers. So those are the elements that are part of the strategy, and we want to make sure that as the world moves into this transformation or digital transformation of health to advance health targets, health goals, and to bring those positive health outcomes, those key elements, both the key guiding principles, but also those 4 objectives are at the core of the strategies that are designed at national level, but also the strategies that are adopted as we progress and as we evolve in this transformation. Now, diving in a little more on what we are doing on mHealth, we do have what we call it the Be Healthy, Be Mobile program that really look at how we can bring about the mobile health to countries. We have done tobacco cessation, dementia, and a number of other tools to help public in general, diabetes. We have done in a number of countries to support key challenges that some countries have from the disease perspective, or what is the disease burden that they want to address, and then create the framework that be it a handbook or mobile app to support both operation management and then adapt the content and then create these mechanisms that allow the community to embrace, but also to adopt and benefit from technology. But let's not forget that there are communities that are not yet connected to broadband. So 47% of the world still don't have access to broadband or to internet. And as we go digital, we want to make sure that we leave no one behind. So there's that Sustainable Development Goal target of leaving no one behind. So we need to therefore work with a lot of partners to ensure that we don't service just half of the world, but we service also the other half that requires inclusion into the digital ecosystem, but also access. So the issues of equity, genders, and equity, gender, and the inclusion is very key, is very central to what we do. Within the Be Healthy, Be Mobile, one of the programs that we have is oral health. We just just finalizing this program with the government of France, and then our last governing body meeting called Executive Board, which took place last year. We have actually passed a resolution on oral health. And if you search EB 148/8, EB 148/8, so you will see the resolution that is proposed to go to the next year World Health Assembly on oral health. So that's and then as that resolution gets approved by member states, we also starting on oral health program, which focus on literacy, training, early detection of oral diseases, but also surveillance. So using our Be Healthy, Be Mobile program. So that more details on that. If you need more details on that, I'm happy to provide. But this is just to say that digital technologies, both at the primary healthcare, but also looking at the universal health coverage, at vertically or cross-cutting is very key. To conclude, I want to say that from WHO perspective, we want to ensure one, safety, second, sustainability, and inclusivity as we apply, as we implement, as we develop those digital technologies to achieve those universal health coverage goals, to achieve the targets that we set in Sustainable Development Goals, to ensure that health is not a privilege, health is a right for everyone, to ensure that the world actually remains safe, healthy, and protected from diseases that we can actually protect, and investments are placed in the right areas to ensure that what we see today with the pandemic, where we have our predictive modeling for health is very where a predictive model for health is very weak compared to the predictive model for weather forecast, for instance. So we have work to do. Today, weather forecast has a much better prediction than virus spread forecasting, or a disease prevention forecasting, or even emergency response forecasting. So I think the tools are there, the capacity is there, but I think we need to work more horizontally, collaboratively, and to ensure that we reap all the benefits that digital technologies can bring in the health sector. So I stop here and to say thank you very much, and happy to answer any question that you might have. But let's bring our minds, our brains, our capacities together to ensure that we all collectively and individually contribute to a better world, and to better health, to a better world, and to a better well-being of all the people in this world. Thank you.
I would like to thank Bernardo Mariano for this amazing lecture. Very interesting, great things ahead. But we have questions already, but first I would like to welcome Dean Laurie McCauley, the Dean of this University of Michigan School of Dentistry, and also William K. and Mary Ann Najjar, Professor of Periodontics. So welcome, Dean McCauley.
Thank you. Thank you, Alex. I'm going to use first names, not out of familiarity, but just to help bridge this virtual gap and make this a little more comfortable. So thank you, Alex, for your vision and for the keen implementation of this program. Thank you, Chuck, for your long time and solid partnership in our efforts in learning health systems. You've been a fabulous partner. And Bernardo, wow, traveling all the way from Switzerland to be with us today. Thank you so much for your wisdom, your clarity of perspectives. I love the three-part: promoting health, safety, and saving the vulnerable. The messages that you have are really clear, concise, they make sense, and just demonstrate huge value. I also say it is fabulous to see such a diverse participation today. I think we've had people signing up from nearly 200 participants for the entire presentations today. And the diversity of people who've signed up give me great optimism. We have people from the School of Dentistry, from our campus, Michigan Medicine, the School of Information, the School of Public Health, the School of Education, from our neighbors at Eastern Michigan, from the Cleveland Clinic. We have people from multiple states: Texas, California, New York, Nebraska, and multiple countries: Canada, Brazil, Switzerland, India, and Chile, just to name a few, as well as some really dedicated partners from Colgate, Delta Dental, and from private dental practices. And just the diversity of individuals interested in this area and wanting to engage and move us forward to promote health, safety, and save the vulnerable. What a great effort today. So representing the University of Michigan School of Dentistry, we're the first dental school founded in a public university. And so we have a really strong focus on serving the public. We have strong programs throughout our state of Michigan, as well as globally. I'm going to touch on three things, and I was just thrilled, Bernardo, to hear you bring up oral health. Of course, near and dear to my heart. I want to focus on a few things to me that are really critical in us moving forward in this digital efforts. I want to talk briefly about oral and dental disease. I want to really emphasize prevention And how do we mobilize digital platforms for prevention? Because I think it's an area that we could really go far. And then finally, I want to touch on the role of academia in this entire effort. You know, we know how important government and private industry is, but what can academia do? So I have to emphasize the importance of oral health. You know, we live in the United States in a very high socioeconomic country. So many of us underappreciate how widespread and devastating oral diseases are. They affect 3.5 billion people worldwide. That's nearly half of the population of the entire world. And I was interested in Bernardo's data that half of the world perhaps doesn't have broadband or internet. Well, you know, I'm sure it's not that exact half, but it's also quite notable how widespread dental disease is. In fact, dental caries is the most common disease globally. More than 500 million children have caries in their primary dentition, otherwise known as their baby teeth. Children with poor oral health miss school. They receive lower grades in schools than those with better oral health. And so that sets them up on a lifelong trajectory of disadvantage. In permanent teeth, untreated dental caries is the most common health condition according to the 2017 Global Burden of Disease. If it's untreated, it can lead to pain, and we're going to hear about pain in one of our breakout sessions, infection, tooth loss, and more complex and extensive procedures. As a periodontist, I have to note that periodontal disease affects 10%. Severe periodontal disease affects 10% of the global population, but mild or moderate forms have much more widespread impact globally. And beyond dental caries and periodontal disease that we are most familiar with, about 1 in 5 people will suffer trauma to their teeth during their lifetime. Cancers of the oral cavity and lip are one of the top 15 most common cancers and result in nearly 200,000 deaths per year. We also, in oral health, spend a fair amount of time with genetic conditions such as cleft lip and palate, which are some of the most widespread genetic conditions affecting nearly 1 in 1,000 newborns. So beyond just the direct impact of oral health, there's a strong relationship between oral health and general health. In particular, many studies show evidence of diabetes and periodontal disease, as well as causal links between sugar consumption, diabetes, obesity, and dental caries. Severe tooth loss is 50% higher in patients who have asthma, diabetes, emphysema, heart disease, liver conditions, rheumatoid arthritis, or a history of stroke. When we talk about the global impact, it's important to note that oral health, the treatment of oral health conditions is often not part of universal health coverage. In high-income countries, dental treatment averages about 5% of total health expenditures and 20% of out-of-pocket expenditures. But in low and middle-income countries, there's often a total lack of services to prevent and treat oral health conditions. These conditions disproportionately affect the poor and socially disadvantaged. And so when Bernardo has an emphasis on this, I think, you know, these are conditions that really link to problems with the oral cavity. The CDC has suggested that the healthcare system could save up to $100 million per year if dental offices perform screenings for diabetes, blood pressure, and cholesterol. Bernardo, you mentioned tobacco cessation. This is another place where, as a profession, we've had an ability to make an impact, and in future and in conjunction with digital efforts, I think could make a huge impact. The second area, I just, near and dear to my heart, and I would say that the dental profession has long been known for its emphasis on prevention. I think it's worth thinking about, how do we mobilize digital platforms for prevention? In fact, it could be much easier than mobilizing digital platforms for treatments of diseases. And obviously the savings would be huge. Most oral diseases share risk factors with other leading communicable diseases such as cardiovascular disease, cancer, and diabetes. And these risk factors include tobacco use, alcohol consumption, and high sugar diets. In other words, most oral diseases are largely preventable. Promoting a well-balanced diet, low in sugar, avoiding tobacco, reducing alcohol consumption, using protective gear during sports can protect teeth from trauma. Exposure to fluoride, sealants, and on and on. I think embracing a concept of prevention in regards to digital platforms is hugely important. And finally, I think it's really important for us as a university to reflect on the role of academia in the efforts of moving forward digital healthcare. Our partners in government, in the private sector, are moving these forward. Bernardo, mentioned the different cultures in the health sciences being a helpful culture, and in the technical areas, the benefits of monetizing data. What is the role of academia? And how can we best train a future workforce to implement digital technologies? I will say personally that this is something in our profession that is really challenging. Dentistry is a surgical specialty, and our educational systems have to ensure technical competency. There's a lot of time spent in developing technical skills, a knowledge base, and ethical underpinnings. So how best can we incorporate digital technologies in our educational systems to be able to match and meet the goals that you have mentioned, that the WHO has really beautifully set up for moving forward a digital agenda? I'll stop there. I'll just say that I'm really thrilled to see the 3 great breakout sessions. In fact, it's tough to decide which one to attend. And what I was told is that they're going to be recorded. So those of you who are also challenged by trying to prioritize which to attend, hopefully we'll be able to see all of them. I also just want to again thank all of the staff support for putting this together today, and members of the LHS Collaboratory. And Bernardo, thank you again for spending time with us today. And I will turn it back to you, Alex.
Bernardo, Mariano, we already have questions from the group here and from the audience. And the first one is from Ivo Dinov, Dr. Ivo Dinov from the Michigan Institute for Data Science. Human healthcare improvements due to digitalization of health is predicted on availability of effective and timely mechanism to interrogate the digital data as proxies of health states. How important are the notions of data sharing and open science are for WHO's Global Digital Health Initiative?
Thank you. That's an excellent question. I think this is a paradigm that we need to navigate between open source and open data sharing versus privacy, versus how we can ensure that the data sharing mechanism, which is a key and very important for research, is not caught into this nationalistic attitudes of many countries. Actually, we're seeing that where, for instance, countries today are saying data of my citizens do not leave my national borders, and yet for research to really add to the value that we need to see on research, we need this data sharing mechanism. So we for instance, the clinical trials data is one of the areas that during the pandemic was key. So WHO brought together the elements of a clinical trial. But for instance, we are also setting up a genomic data hub in Switzerland to ensure that the whole world can really benefit from gene sequencing data, which is important, not just sitting at a national context, but it has to, we need that international framework. Of course, all that has to be done with the caveat that the data is not monetized. I mean, the tech companies do not take that data and then monetize from there, because anyone, I mean, like as I say, the culture of health in health life sciences, if my data is going to help somebody, I'm willing to give that data. But if my data is going to make somebody monetize and create revenue, well, at least we need to find a mechanism of revenue sharing, if not talk about privacy and ethical considerations. So I think those are key areas. And then when I mentioned that we are working on the framework of international health data regulation, it is to address those challenges at the global level. At national level, I think there are rules and the data privacy rules that guide the data sharing mechanism, but the gain for artificial intelligence, for instance, the gain for research requires more than the national data context. It requires these global data sets to really ensure that a diagnostic done by AI that access data from Africa, Asia, America, Europe, and it delivers the accuracy needed that device can work in the whole world. So I think those are, but certainly, yes, we want to make sure that those key principles of data sharing and somehow monetization and a framework that allows the monetization of health data works in such a way that we see benefits, both health benefits, but also benefits of the data owners, and let alone the whole consent. Like today I share my data, tomorrow I don't want to share my data. So how can I as an individual have the freedom to say, today I decided I'm going to donate my organ, but 2 weeks later I decided I don't want to donate my organ, so I can go and revoke that. So how can you do that in a digital ecosystem? I think those are the challenges that we see, but also those are the challenges that we need to address to ensure that we reap those benefits.
Thank you very much. And so we have a question from Mahbub Belivan. Are we look at integrating medical and dental health records for each patient to facilitate digital health records? It's something that you mentioned about having these silos for disorders or specific health areas. So are we now integrating dental and medical health records?
Certainly, many countries today have the electronic health record. I don't know if the question is for me, but all to say that the integrated personal health record for either for dental or for diabetes or for any type of diseases, it's key. Now, what we don't have today and I think in many states, and all of you have the experience, you go to your physician, you provide a set of data. You go to your dentist, you provide sets of data. You go to see a specialist on TB or cancer or anything. You keep providing data. So how can, and some of the data sets that you move from one area to the other as we grow through and go through the different specialists, it's the same data set. There's a core data set. So how can we, so the personal health records that is part of the global strategy on digital health, it does address the need to have this portable personal health record that a patient or individual can carry around and share with everyone. And we are working with a number of partners to make sure that interoperability takes place.
Yeah, I would love to also comment on that, because I love the vision of that, Bernardo. But I would just say, I think we are far from where we need to be to really be at that point. There's work from our school, from Lynn Johnson and Bob Eber and others who, for instance, have looked at prescription drugs that patients have reported in the health system and what they report in their dental electronic health record. And so many of them not meshing, not being the same, because the record's not effectively talking to each other, and the patients not reporting accurately the same information at multiple sites. So to have it be really a portal that is consistent across all of the different healthcare sectors would be huge.
American Dental Association. From the figure presented, one may infer that the progress on the application of AI across sectors can be explained, in part, by how risk-averse are these sectors. What would be your suggestion for AI developers thinking about dedicating efforts to AI application in healthcare sector? How can we innovate in a sector that, for understandable reasons, moves over cautiously, slowly?
If I may take that, finance is a risk-averse sector, and yet AI is heavily used in the financial sector. The regulations on financial sector is not as heavy as the regulation in the health sector, because the analyst can work in US and come to Europe and work without having to do the whole process of accreditation and certification. But on the other hand, from WHO perspective, we are working with International Telecommunication Union, and we do have a group looking at the benchmarking of AI. But it requires indeed the contributions from the AI experts, the data analysts, to really address some of the regulatory blocks that technology will have. We also work with the regulators. There's a group of regulators that meet every year. We work with them to ensure that common practice on regulating AI devices for health is applicable across regulators in Europe, regulators in Australia, or in US, or even in Asia, in China, for instance. So that's the work that we continue to do. But I think one key question, and that key element, is because AI, you have the algorithm, you have the data, and you have the computing power. Now, on the data side, our regulation on data, at least global regulation, still needs to be strengthened. On the algorithm side, we want to make sure that as regulators approve a device based on an algorithm that device has during the approval time, any subsequent updates of that algorithm, it keeps delivering the same outcome at which the regulator approved. So So we need to find an element of no longer one approval and then forget about this, look at it 2 years later, but a constant element of quality control, monitoring, and benchmarking to ensure that the AI device that is for instance, doing diagnostic of cervical cancer continues to deliver the same quality of diagnostic as it was stated during the initial stage of regulatory approval.
Thank you very much. And so I have a question for Claudio Buck. What's the public trust in digital healthcare? And I have a additional question there. The same applies to social media, where information related to health can help, but also you have a negative trends, for example, against vaccination that also affect the spread of information that instead of helping the public can actually affect it.
I mean, during this pandemic, actually, one of the new, I would say, areas of epidemic, in addition to the pandemic, we have the infodemics going on right now. And actually brought together a number of experts around the infodemics, because the infodemic can be as deadly as the pandemic, right? And you mentioned vaccination, misinformation of vaccination, that's one, but the misinformation on when the pandemic is active can lead to a number of increased deaths because of that particular misinformation. So a new science, let's put it this way, of infodemics is being established as we speak, and I think the role of academia is key around creating the new, I would say, workforce that address those particular areas of a merger of tech med or med tech, because today. And that's a challenge for the academia. A medical doctor to do medicine and then be a digital expert or technology might need to do medicine and something else. So may need to spend 6-7 years doing medicine, depending on the country, and then additional 3 years to do another degree on the technology. So many other areas, and that's where I think we need to also think out of the box from the, I'd say, from the academia side to incorporate some of these dual degrees within the medicine to address this transition or where technology plays a very key role in addition to the core traditional way of delivering medicine and health. So our role in the digital transformation is to create a trusted ecosystem. I can give you another example. Today, AI, and then we have a lot of bots. With the pandemic, we had pretty much every country released a bot to answer questions about the COVID-19. But what we're not doing, and that's where, for instance, from WHO perspective, we see that we want to promote that, is to create a trusted ecosystem that say, if as individual, I know that if I go to a hospital, I trust that the standards and the treatment will meet a certain regulatory framework of certain quality. Of course, if I go to somebody that is sitting under the tree and say, treat me for my disease, of course I'll get the level of quality very different from what I get in the hospital. So creating trusted digital ecosystems in different areas of health is key. And we are open to partner with a number of academia to really drive that, to ensure that the people and populations and patients, they know that if they get into that space, that's a trusted ecosystem. But of course, there's the other way around as well. We recently identified gaming disorder as a disease. It's now part of the International Classification of Diseases. And we had a lot of pushback from a number of companies that produce games. But I always say that if we want to tackle the issue of gaming disorder, we have to operate in the gaming ecosystem, not outside. Meaning that we need to build virtual hospitals inside a game to ensure that the gamers, we interact with the gamers in the ecosystem they are in, and not outside that ecosystem. So those are some of the key, the paradigm between one is creating this trusted ecosystem where people come, but the other is to bring the trust inside the ecosystem where people are operating.
That's a great statement, definitely. We have a question here, Bernardo, from Dr. Ramesh Nada from the University of Michigan School of Dentistry, one of the speakers here. Thank you, Bernardo. One of the WHO goals you mentioned was universal coverage for 1 billion. But is universal health the answer for everyone? Is the U.S., in the U.S., the states deliver health care and have autonomy to implement it as they see fit for their state. True universal coverage in the U.S. is unlikely to ever happen. How does WHO see the U.S. in the context of those goals? And one thing is like it's a private or even public health coverage. That's one part also that adds to that question too.
Yeah, I think the different countries have different problems, but that lead to the same, is access to health, right? Or access to healthcare. And in a country like Mozambique, I'm from Mozambique, people don't have the health facility to even go to, or they have to walk kilometers to get there. In a country like US, we need to address, for instance, to ensure that people are not out of pocket. They don't become poor because they had to pay health bills. Because yes, there is a private healthcare facility, but then we are basically contributing to poverty just because of out of pocket money. Due to a health expense, and I think it was mentioned here as well that dental is one of these areas that can bring people with out of pocket funding because of investment or because of expenses on dental costs. Now, for each state, I believe that no state would be sitting down and just see people dying of a particular disease without doing anything, just because so actions are different from country to country, but access to health and it's not just about having the facility, but it's also about having the ability to use that facility. And then universal health coverage in developed countries, it's about having the ability to access the health care that they need. Because it exists in a developing context, is about creating that facility which does not exist.
Yeah. I have a time for only one more question. We have several here, but there is one from Iran Kurhan. How we can start is underdeveloped countries where there are less resources available, you just mentioned, and any good strategies. And I will add something is, for example, Doctors Without Frontiers. So when you think about telemedicine, is this a new area of delivery via digital health care for underdeveloped countries? Is there like new approaches towards those countries?
For developing countries, I think this is the opportunity to think differently and act differently. You just mentioned telemedicine. Today, telemedicine challenge is not the technology. It's a regulation. It's policies of countries. And developing countries should definitely leverage on that to deliver that additional healthcare to people that do not necessarily have the ability to even go there to the hospital, but also to allow health professionals sitting in another country to actually deliver and provide health services to people sitting on the different countries. So it is important that we look at the two perspectives. One is the regulatory perspective or the policies of the country. That I think it sits within the national government. But the other, which is very important, is healthy investment in health should be prioritized. Not investment in the defense costs or not investment in other. Health needs to be prioritized much more than before, because until today, I think the budget envelope of that Ministry of Health have, if there's one thing that I'll ask every government to do now, is please increase the Ministry of Health budgets to ensure that they deliver good health and well-being for the people in your own country.
Oh, this is a great statement. And I, unfortunately, we do have several questions here, but we don't have the time. But we send the questions to you.
Thank you.
And I'm very pleased and really enjoyed these questions and answers. Thank you everyone who sent the questions. But I will pass now the mic to Dr. Friedman.
Thank you very much, Alex. Wow, what a terrific set of presentations. I think I learned more in the last hour than I have learned in the past month. This was so educational and so informative. Thank you, Bernardo. Thank you, Lori. Thank you, Alex. This was a terrific session. And we are now moving into the post-event, which is the breakout groups. Before we do that, let me just mention a couple of other things. There is a post-event survey. There will be a link available to this as you exit the webinar. We learn from your feedback. We change from your feedback. So please take a moment to complete the survey. A link to the webinar materials will be placed on the Collaboratory website. There's a link to it here. Now, interestingly, given that Bernardo was speaking from Geneva in Switzerland, our next Collaboratory event will be featuring the one national learning health system initiative in the world, which happens to be in Switzerland, and we are going to be very, very privileged to hear a presentation from Stefan Bess in Lucerne, Switzerland, who directs this effort. So please join us for that. We will now move into our post-event breakout sessions. So to do this, you will need to join via a specified Zoom link. The links are shown here, and you can go directly into the breakout room of your choice by clicking on these links. Now, the way to do this is twofold. You can go to the email that was sent to you prior to this meeting, and from there you can just click on the Zoom link of your choice and go directly into the breakout room, or you can go to the Q&A while you were still logged in to this session and open the answered submenu in the Q&A window. And there you will find these same three links into the breakout rooms. And I believe, I hope it's the case, that if you click on the link from the Q&A window, you will go directly into the breakout room of your choice. I will give 1 second for Kathy or one of the staff to correct me if what I said was incorrect. Okay, hearing no correction, please either use your email message or the links in the answered section of the Q&A window to go to the breakout room of your choice, either LHS and pain, LHS and Caries risk, or LHS and opioids. 3 very interesting discussions hosted by 6 very interesting and informed facilitators, but these will be very interactive sessions. So thank you again for attending, and please enjoy the breakout sessions. Have a terrific afternoon, everyone, and thanks for coming.